Joining us now on the program for our weekly mental health discussion is Carrie Krawiec, a therapist at the Birmingham Maple Clinic. Carrie, thanks for being with us today.
Thank you, as always, for having me.
Glad to have you on. Last time we had you on, you were talking about with us about New Year's resolutions and some of the various ways that we lead ourselves into those, and ways that we make them maybe not so effective, and ways that we can make them more effective. And one of the things that many people do engage in at least in the month of January, as part of a New Year's resolution, so to speak, maybe one of those smaller resolutions, is to refrain from consuming alcohol during the month of January, and something that's known as dry January. And while it can have several different health benefits for your physical health by not consuming alcohol, and maybe can help with some other goals you may have set for the year, it can also have a number of mental health benefits. Can go into a little bit of how refraining from alcohol for a month or for a certain period of time, whatever it is, can actually be beneficial to your mental health.
Well, dry January becoming a thing is actually itself so helpful. Like we talked last week about New Year's resolutions, having a social norm for something where other people can kind of engage as a community around something really helps for success. So even the phrase dry January helps give us all permission, so that if you were out somewhere and said, look, I'm not drinking this month, nobody might pester you or encourage you or push you to say, hey, it's dry January, and it's a little bit more accepted, which is certainly a positive thing.
And and as we get to a point where this is more normalized and it does have a name to it, and more people are gathering onto that, how can that also help to relieve some of the worries, or some of the barriers that may have been there previously to somebody maybe wanting to take a month off from alcohol, or reduce their alcohol consumption as one of their goals, especially given that alcohol so often in our society is part of social interactions, especially for those adults that are legal with it.
Yeah, absolutely. So it's such a helpful thing too. There are people. This other topic has come up called sober curious or gray area drinking. So these are people that are drinking more than they would like, but perhaps less than puts them in what would be considered like an alcohol abuse disorder or alcohol addiction. So they're in this middle space where they don't really like the amount they're drinking and they're curious about stopping. These are the people that are the best helped by taking a dry January. Alcohol abuse and alcohol addiction really needs to be treated by medical professionals. It may require detox, it may require special drugs that help limit the use. But for gray area drinking and dry January really helps people to explore their use, to gain some mastery over quitting, to gain some confidence in themselves. That when you try to quit, but you don't, you're really putting yourself in another category, that category of addiction. But if you can quit for a period of time, it helps to improve sleep. It helps to reduce anxiety and depression. It helps to just feel overall healthy, maybe lose weight, certainly save money. There's a lot of positive effects. And when you feel that control, it also can change your brain chemistry. So, what they find is that people who even take just 1 month off of drinking feel healthier and have healthier habits across their health. Even 4 months later, 6 months later into the summer, they've just exercised their own discipline and self control in ways that helps them all year long.
And Carrie, we know that uh, that alcoholism and alcohol dependence, or issues with alcohol, they are their own individual health issue, and their own individual mental health issue. But for those that may have other mental health issues and mental health situations that they're dealing with, alcohol can have maybe a negative effect on those as well. So talk about how that can also play into how dry January can affect those that maybe have some other mental health concerns that maybe they don't believe, or they don't recognize alcohol as contributing to in some negative way. How can that help them?
Sure. So, like I said before, so alcohol use is connected to 60 different health and physical health and mental health disorders: cancer, diabetes, heart disease, hypertension. So anybody who cares about their health is going to have anxiety knowing that they're doing something in direct contrast with their health and wellness. But certainly it's going to impact, like I said, sleep issues, weight issues, other things that are going to contribute to someone's self-esteem and insecurity, as well as just actually chemically contributing to anxiety and depression. So taking a month off helps to reset brain chemicals, helps to boost confidence, helps to improve overall health and wellness, improve sleep, improved eating, improved choices in a variety of life areas that are going to help reduce the incidence of co-occurring mental health issues.
We're joined by Carrie Krawiec on today's edition of the Megacast for a weekly mental health discussion from the Birmingham Maple Clinic. More information can be found on their website, and get in contact with the professionals at the Birmingham Maple Clinic, birminghammaple.com for all of that, birminghammaple.com. And Carrie, just to circle back to this category of gray area drinking. So, and it doesn't seem as severe when you define it as being someone who's drinking maybe more than they would like to, but it's not causing them problems because we're putting into that definition. It's not causing them problems at the moment, but that can lead to some problems down the line, I would presume, as you maybe dive more and more into consuming more alcohol. Your dependence is going to change, and then all of a sudden you could have yourself in an issue with an issue with your alcohol consumption. So just how dangerous can that gray area drinking ultimately become for someone that maybe is diving into that sort of category?
Well, absolutely. I think you bring up an interesting point. Why isn't it causing problems, right? So like if we think and what are problems, right? So someone may say, "Oh, I'm fine. I've never had a DUI or I've never missed a day of work." And then socially we say, "Oh, okay, well yeah, then that really isn't a bad thing." But if your family's commenting on it or perhaps you've had some blackout nights, then maybe those are problems, but you don't call them problems. Are you being secretive? Maybe people don't know. So it would be a problem if they did know, because they'd be drawing attention to it or confronting you in some way. So you're right, the gray area gets really gray, right? How are we defining what problems are? And how are we addressing those problems and the underlying problems that might be causing it? Also, like you said, some other problems don't emerge till over time. Fatty liver, cirrhosis, it might not happen today or tomorrow or the next day, but you could have, you know, a heart attack in your 50s, and that would be really concerning, and it could be connected to this use at a younger age or stage.
And so as we're connecting all this back to dry January, and we talk about the various physical and mental health benefits to, taking a month away from alcohol, or significantly reducing your consumption of alcohol during the month of January or anywhere else during the year as part of some sort of a New Year's resolution. How can people best take advantage of that to address their relationship with alcohol, whether it be social, whether it be something that's maybe a little bit detrimental to their life, or significantly detrimental to their life in the way that they didn't realize? How can they kind of take that inventory while dry January continues to go on while they're participating, and really turn this into something that benefits them outside of just the month of January?
Well, I think it could and should raise a lot of questions for people, and ones they should be willing and want to answer, especially if they're using it the best. If you try to stop and you have a hard time, or it's a couple days and you're already slipping up, like we talked about, the day that resolutions get thrown away, which would be tomorrow. So, if you've tried and you've already slipped up, ask yourself why. What impulses, what drives, what social factors, what other things maybe contributed to that, and try again. And then if it happens again, ask yourself again, or ask yourself, is there something about the situation that needs more than just my own willingness to adopt this, right? And then if that's the case, seeking therapy, seeking treatment. When it comes to alcohol use disorders, there's such a broad range. There are AA groups and things that are free and convenient, at least to get started. There is, of course, detox and longer term treatment. So it's not just a one size fits all method, but there are ways to start, even just dabbling with, I've tried and I've not been successful. So, like, what else do I need to try? What other deeper layers do I need to explore to support me as I'm exploring my alcohol use?
And so what sort of questions or what sort of, checkpoints should people be really keeping note of mentally or actually physically taking note of as they're exploring their relationship with alcohol during dry January to be able to take that sort of mental health inquiry and overall health inquiry about how alcohol impacts their daily life?
Sure. I mean, evaluating how much you spend time, thinking about drinking or acquiring alcohol, or, do you plan your events around whether alcohol will be present or not? Do you feel deeply uncomfortable when it's not? And like those would certainly be questions to be asking yourself. Do you what is the messages in the community around you, your family of origin or the family you're in? What kind of drinking is acceptable and not acceptable? Are there histories of alcohol use disorders, which would certainly be a predisposing factor to having one? So, what things have I seen in my history? What things do I see in my present that are cause for pause?
We're joined by Carrie Krawiec from the Birmingham Maple Clinic on today's edition of the Megacast. You can get in contact with them at birminghammaple.com. That is birminghammaple.com, or call them 248-646-6659 for more information as well as consultations. 248-646-6659 for more information. Carrie, a couple more minutes with you today. Anything else that we should be focusing on as we're addressing this issue of people's relationship with alcohol and how that relates to their mental health or dry January or any other mental health issues or mental health points that we should be keeping of mind at this time?
Sure. So alcohol use, is very cyclical, and it comes with associated feelings. So of course there's the positive euphoric feelings you feel when you're a little bit intoxicated, but then afterwards there's a hangover, and that's the same emotionally, right? So the physiological symptoms, the emotional symptoms, there might be guilt, anxiety, shame, and those painful feelings can actually contribute to increased use because you're feeling poorly about yourself, but you already know there's something that could make you feel better. So using identifying some things, some other things that would make you feel better. Is it talking or connecting with other people? Is it adding something new to your fitness? Is it adding a new routine or a new activity? Trying to add some, I call them speed bumps, but some places where you would normally drink, what are some things that you could throw in to interfere, that would perhaps keep you from that environment or that situation, to see if you can sort of prolong those times, gain some confidence in yourself, and some enthusiasm about some other things that are going to give you that euphoric feeling, that dopamine, that whatever it is that you need to feel a bit uplifted, so that you can replace that cycle of shame, blame, whatever else it is that drives that negative process to keep going.
As always, you can get in contact with Carrie and the other professionals at the Birmingham Maple Clinic for more consultation and discuss these sorts of issues in more depth and on a personal level by going to their website, birminghammaple.com. Send them an email, info@birminghammaple.com, or call them 248-646-6659. Carrie, thanks as always for joining us.
Thank you for having me.